Should older adults with GERD consider pH monitoring? Imagine trying to solve a mystery where the clues are hidden and the evidence is unclear. That's often what diagnosing gastroesophageal reflux disease in older adults can feel like. If you or a loved one are dealing with persistent or confusing symptoms, pH monitoring might be a helpful step. This test measures how much acid comes up into the esophagus over a full day or longer. It involves placing a small device either through the nose into the esophagus or attaching a tiny capsule to the lining of the esophagus. The wireless capsule usually stays in place for about 48 hours, providing a more comfortable experience. pH monitoring is especially useful when symptoms don't improve with medicines like proton pump inhibitors or H2 blockers. It can also help if symptoms are unusual, such as chest pain, coughing, or hoarseness, which might not be typical signs of acid reflux. For older adults, this test can clarify whether acid reflux is the real cause of their symptoms or if something else is at play. Since older adults often have other health conditions, it can be tricky to tell if symptoms are from GERD or something else like heart issues or respiratory problems. pH monitoring gives an objective picture of acid exposure, helping doctors decide if GERD is the main problem. This can prevent unnecessary treatments and guide better management. The test is generally safe, but it might be a bit uncomfortable for some older adults. Tolerance varies, especially if there are issues like nasal congestion or swallowing difficulties. Doctors will weigh the benefits of confirming the diagnosis against any potential discomfort or risks. In many cases, pH monitoring is recommended after initial treatments fail or when endoscopy results are inconclusive. It helps determine if acid suppression therapy is working or if surgery might be needed. For older adults, confirming the diagnosis can mean fewer unnecessary medications and more targeted care. So, if symptoms persist or are hard to interpret, discussing pH monitoring with your healthcare provider can be a smart move. It's a reliable way to get clear answers and help make the best choices for long-term health.